Welcome back to the program. Well, this week the appalling tragedy of war once again has been made all too clear. Another Australian soldier lost his life in Afghanistan. And the young wives left behind, of course, are devastated. Now, some are hoping to keep the memory of their loved one alive and keeping their dreams of having a family through IVF using their lost husband's sperm. More and more soldiers are choosing to freeze their sperm before heading to the front line in case something terrible happens to them. But is this taking medical miracles too far? What does the law say this morning? Dr. Frank Quinn, who is a fertility specialist, and also psychologist Kimberly O'Brien join us. Good morning.
Good morning.
Dr. Quinn, could I ask you how many people are taking this sort of action, especially in the armed forces?
I mean, it's a growing area in the last sort of 10 years, but still I probably get half a dozen requests a year, so it's not a big area of our fertility practice.
Mm-hmm. From soldiers or other people undergoing treatment?
From soldiers. Still by far the biggest area where men freeze sperm are those that are recently diagnosed with cancer, testicular cancer, lymphoma, and they want to have some sperm frozen before they embark upon their chemotherapy in the event that the chemo renders them sterile, and that way they've got sperm to fall back on and use at a later date.
But certainly you've had half a dozen requests from soldiers going off to war.
Absolutely.
Kimberly, this opens up the ethical question of if you lose your husband, whether you should be impregnated through IVF. What's your view?
I think when widows are in in that moment of grief, it's a very difficult decision to be made. And also we need to look at the child's perspective. So when the baby is born, they're going to be born into a fatherless family. There's going to be quite a lot of pressure on them to fill the shoes of the father perhaps, or being compared to the father, as well as having an incredible sense of pride and a connection to the past. So there's positives and negatives, and I don't think there's any clear-cut yes or no in this situation.
Is that something, Doctor, that you actually discuss with your patients when they come in asking this?
Oh, absolutely. I mean, this is a decision that's not taken lightly. The reason it's important to these couples, so they come along and they want to find out what the information is and what the options are. And at that same time, they're offered counselling. This is a very, very important decision, and it's not taken upon lightly.
Is it fair to the child? I mean, here you have a child growing up who will never know their father, and I can imagine the yearning, the pain and the suffering, the loss from a young woman, you know, a 20-something woman yearning to have a baby and have a connection to someone they've lost. But is it fair to a child, and how can you ever even possibly answer that question?
Yeah, I think it's a really difficult question, because kids are going to be growing up as the symbol of the lost father, and that's incredible. You know, it's quite heavy and intense to carry that through life. But at the same time, you know, if the opportunity is there for the widow that has lost the partner, and they've talked about having a family, and they've had a family counselling session perhaps before they've gone to war, why not? Why not go for it?
What is the law?
Well, currently in New South Wales, there needs to be written consent to be able to use that sperm. So basically, typically with people going through IVF, in the event of death, on their consent, they'll nominate whether they're happy for their embryos or sperm, frozen sperm, to be used by their surviving partner, or whether that tissue, those embryos, would be used in other ways. So unless it's in writing, then we can't come back at a later date and use those gametes or those sperm.
Last year, you were in fact involved in the case of removing and freezing sperm from someone who had died. They were actually had made an appointment for the following day for an IVF clinic. What's the status of that case? Maybe just elaborate a little.
Well, the situation there was they were going through fertility treatment, and they were in the process of embarking upon IVF, and he unexpectedly passed away with a work accident. And the wife then proceeded to go through the courts, New South Wales courts, and get a court injunction to have sperm retrieved from her husband that had passed away. So,
and what's the status of that now?
Well, the sperm's now frozen in our clinic at IVF Australia, but because there was no written consent beforehand, she now has the case with the Attorney General to try and have access to that sperm.
That's well over a year on.
It was late last year, yep, so at least 6 months down the track.
Yeah. Well, it is an extraordinary discussion to have, an open-ended one, but Dr. Frank Quinn and Kimberly O'Brien, thank you very much for your time.
Thanks, Kerry-Ann.
Okay, and I guess, again, we open this question to you, our viewers. Would really like your input. Do you think it's okay to have a baby? Would you do it? Have a baby after your husband died? Is it fair? Is it something that would fulfil you? We'd love to get your input, kerryann@9.com.au. Now, here's something else for you.